Thank you, Presiding Officer, and can I also thank Labour for bringing this debate to the Chamber. The only time we get to hold the government to account on health is during opposition time. And even then, we know Labour and ourselves will lose the vote because the SNP and the Greens will band together to defiantly say we've somehow got this all wrong. Now, Humza Yousaf often talks about challenges. He talks about a recovery from the pandemic, forgetting that the NHS under the SNP was creaking before the pandemic. Of course, the background to this debate today, as we've already heard, is the leaked discussion of health chiefs where various ideas were floated, including charging people who can afford to pay. But we already have a two-tier health service under the SNP. I've had constituents come to me who can't even get to speak to a GP, who've contacted me to say they've gone private. One in particular stands out, and that's someone who ended up paying thousands to see a GP privately, then pay for a minor procedure. And that's just not acceptable. And quite apart from the unthinkable leaked discussion, we've already have a health service where those who can pay get health treatment and those who can't or won't don't. We're all proud of our NHS, but under the SNP, it is becoming the national have-not service. That is the reality on the ground. Presiding Officer, what happens in general practice affects what happens elsewhere in the health service. If people can't see a doctor, they may well end up at A&E instead, or end up getting sicker and going to hospital when that could have been avoided. We need to know what's happening on the ground, but currently we have no idea which GP practices are offering phone calls, no calls or face-to-face appointments. That's not acceptable at the best of times because you need data to be able to plan, and it's certainly not acceptable now. Now, in my own area, Lanarkshire, things are particularly bad. In September, yes.
Monica Lennon.
Thank you. I did try to intervene in the Cabinet Secretary. Perhaps he didn't hear me. So in Lanarkshire, things are especially bad. And from October of last year, we've spent 315 days at code black level. We're facing a second Christmas at code black. Now, Graham Simpson knows for patients and staff in our area in Lanarkshire, this is frightening stuff. So does the member agree with me that we need an urgent plan from the ministers to get us out of code black? Because Cabinet Secretary is right to say we need to thank the staff, but we can't thank the staff if they're working in unsafe conditions.
I thank Monica Lennon for the intervention. She's absolutely right. Lanarkshire is in a state of crisis and has been for too long, and we need to see an action plan to get our area out of that situation. It's completely unacceptable. Now, we've all been inundated with constituents desperate for help. Here are a couple of personal testimonies, one from a resident in East Kilbride who said they found themselves requiring support from a GP today. They say they went to the medical practice and requested an appointment for a foot issue, a very sore foot. They were told there were no appointments that day and there was no pre-book appointments available. That kind of thing is commonplace. I have other examples, but I'm aware of the time. I won't go through them, Presiding Officer. It's not good enough. The situation we face is not good enough, not just in Lanarkshire, but across Scotland, and frankly, the buck stops with the Cabinet Secretary and no one else, and he should do something about it or fall on his sword.
Thank you.